All right, so as always, we're going to kick off with a fairly short Kahoot today. We're going to have a quick pair discussion on some of the readings a little bit after I bring the health belief model back in. We'll talk a little bit more about the health belief model in practice. We're going to jump quickly into the infographic this week because our next assignment is actually due next week. We pushed it up, or we pushed the Twitter assignment back given the strike. So we wanted to quickly get into our next assignment, which will be the infographic. We'll report out to folks about how that experience was to work on the infographic with each other and have some time at the end for any questions or debriefing that we need. So without any further ado, welcome back, future Dr. Beth, kicking it off with our brief Kahoot today.
Okay. Hello, everybody. All right. So make your way over to kahoot.it or log into Kahoot in the app. And the game pin is on the screen, 860-7765. Yeah, and again, thank you guys. Join with your unique name. For some reason, I know some of you guys have like pre-existing Kahoot like logins, and so some times there might be an issue with Kahoot actually using your unique name. So if that happens, just drop in the chat like who you are or shoot me an email, such as Nimble Crab. Yeah. Looks like we're waiting for about, okay. Cognitive/information processing models stress a patient understanding and acting on communication from a provider. True or false?
Oh, the longer one is more stressful.
Yeah. I should go back to the 30 seconds. Oh, okay. E18. All right. Developers of the health belief model maintain health-related behaviors are determined by whether individuals perceive themselves as acceptable to a serious health problem, are willing to pay for an effective treatment, are exposed to a cue, or all of the above. Okay, I can see why you guys, a lot of y'all would have said the red. The most powerful single predictor across all studies and behaviors is perceived susceptibility, perceived barriers, perceived benefits, and perceived severity. So yeah, I don't think I said this one explicitly in my lecture, but let's see if you guys can sort of piece it together or make an inference here. Right. So this is kind of tricky, but the idea is that, you kind of like want to address barriers that people perceive in order to move them toward change. Which of the following is not an aspect of the cognition and information processing model? Present information based on patient's previous experience with the behavior. Stress important information first. Engage the family and the targeted behavior. Provide written information based on the patient's educational level. This will be really helpful if you guys decide to like go into like clinical work, or just general intervention work will be helpful for that too. Mm-hmm. Engage the family in the targeted behavior. Triggering emotions like distress with images could be an effective intervention strategy to influence blank in the health belief model. Perceived susceptibility, perceived severity, perceived benefits, and perceived barriers. Yeah, hope you guys get this one. Actually, one of your classmates reached out during office hours and we were talking about this too. So, and for a hint, the idea is that like this will impact um, one's perceived threat. And I sort of gave an example in my lecture about STIs and sex ed in high schools. Okay, yep, pretty good. Last one, keeping a record of behavior, example, a diet journal, has not been found to be effective in maintaining the desired behavior. True or false? And I'm assuming you guys are taking nutrition this semester. So you guys definitely will be talking about, well, I don't know if you guys take nutrition anymore, but at least I had to take nutrition. And we talked about diet journals. Okay, cool. So yeah, we know diet journals are actually super effective in maintaining desired behavior. Oh, yay. Okay, okay. All right, class. Passing it back to Dr. A.
Thank you so much, future Dr. Bess, and great job, everyone. All right, let's get back to the PowerPoint. All right, Emily, way to go. All righty. I've had the spinning wheel of death. Okay, I was going to say all day, so hopefully it doesn't act up. All right, so I'm going to revisit again what Janae did a masterful job of on Monday, describing this health belief model. And you all seem to really be jumping on board to what it is that you're learning and understanding about this. So again, from a framework perspective, we're coming from understanding how things like the social and ecological environment play a role on individuals' behaviors from last week's. Or thinking about how going through the developmental lifespan can be impactful. But the health belief model is one of the first that we're coming to that's really about individual behaviors. So here, or beliefs and behaviors. So here we're seeing, again, even though there are things that can modify or modify, the way that I think about that is if you're on a seesaw, if you can imagine a tipping point, the thing that tips the balance. So age, gender, ethnicity, etc., can tip how these things work, but the individual beliefs in that blue middle box are really the things that the developers of this model are suggesting are most important for the actions that people are taking about a certain behavior. So again, perceived susceptibility and severity, perceived threat, perceived benefit, perceived barrier, perceived self-efficacy. all of these things impact our likelihood of, and I'm sorry, this, there we go, I'm gonna move this out of the way. The likelihood of behavior change. Cues to action also help us as a nudge, as someone pointed out last class, to engage in that behavior change. And again, if you notice, this is recursive. So it's not always just that individual beliefs go into action. The action also then helps to move back into what it is that we believe about that thing. So if we think that something is super easy to do, if our self-efficacy is really high, wow, we can really engage in that action. And then we actually try to do something about it, and it ends up being much harder. That feeds back into our belief on how efficacious we are to engage in that action. So it's recursive. It tells us information after we've engaged in that action back to our belief system. So beliefs lead to actions, actions feed back to beliefs, and that's a part of the health belief model. So a summary of action with HBM is that if a person believes that they're susceptible or at risk for something, if the condition is serious, if something like a behavioral action can be done to reduce the threat, if there are benefits to taking action, and if the benefits to taking that action outweighs the barriers, that means that the barriers aren't strong enough. So if all of these things exist, it's more likely that we'll engage in that action. So as we talk about intervention strategies or applying it to the world today, you're going to think about how do we maximize these 5 things, right? How do we get people to understand whether or not they're susceptible or something is serious? So thinking back to these 5 elements, how can we ensure that in our interventions, in our approaches to getting people to act, these things are maximized? So that's what we'll come back to in our thinking. So I know this popped up with Janae on Monday, and I think it may have even been one of the questions today. But if we're asking about what the evidence is of the constructs that we've been discussing thus far, so the first question might be, are HBM constructs associated with health behaviors? So we've already discussed some of them. And are interventions targeting HBM constructs effective in changing health behaviors? Again, some of these you've already discussed, but just to make sure that they're clear, with respect to perceived barriers, there's really good evidence of that construct. With perceived benefits and perceived susceptibility, also really good evidence there. Perceived severity of those 3 has the weakest outcomes or evidence for that. And then self-efficacy and cues to action are things that we don't have the most evidence on or the strongest evidence on. So again, when you're thinking about interventions, you're thinking about the interventions that we've read about and applying our knowledge to which of these constructs to target. It's not to say you can't target self-efficacy or cues to action, but you're going to think about, if we know that the top 3 and the top 2 in particular tend to have the strongest evidence, you might want to start there. That might be where you, especially if it's something like COVID, which we'll be talking about today, if we don't really have a lot of time to act, what are the ones I'm going to target immediately? What are the ones that have the most evidence? Those are the top 2, and perhaps again, the third, if you want to include perceived severity. But the 2 at the bottom, the self-efficacy and cues to action, don't have as strong of an evidence base as those top 3.
Dr. Anderson.
Yep.
When you say, like, when you're talking about how, like, the top 2, are you talking about the top 2 constructs or the top 2, like, the top 2 problems within those constructs, if that makes sense?
So I don't know if you can see the screen, Taz, but I'm talking about the numbers 1 and 2, perceived barriers and perceived benefits and susceptibility. So on the right side of the screen, if you're looking, just those top 2 constructs on the right side.
Yeah, I meant, like, so my question was, like, am I looking at the top 2 barriers and the top 2 perceived benefits that people have, or am I just looking at those 2 constructs? Do you get, like, am I making sense?
Yeah, so let me scratch my language of top 2.
Mm-hmm.
I'm literally just meaning the ones that are visible on the screen. So I don't mean 2 elements or 2 behaviors or 2 beliefs of those. I'm just looking at the constructs on the screen. So I'll scratch my language and say, if you are thinking about an intervention, if you're wanting to build an evidence base on your intervention or on your applied approach, the constructs of perceived barriers and perceived benefits and susceptibility are the two that are most evidence-based. And then the third of perceived severity still has some evidence, but it's the weakest of those that I've mentioned thus far. So that's what I mean, Taz.
Oh, okay, thank you.
You're welcome. And again, feel free to jump in at any time if you do need some more clarity. Happy to take a pause.
Quick question.
Oh, yeah, go ahead, Alex.
Looking at like perceived barriers, we know that there's pretty significant evidence around like perceived barriers playing into people's ability or like willingness to take action.
Mm-hmm.
But doesn't that tie in really strongly with self-efficacy, where if you perceive barriers to doing a behavior, your self-efficacy is inherently going to be lower in performing that behavior?
So we'll definitely spend some time looking at self-efficacy in and of itself in later weeks. Self-efficacy is a bit unique relative to some of these other constructs. So self-efficacy is a truly individual construct of how can I do something versus these others, like how susceptible am I to this disease could be in, like, you're taking into account a number of factors. But self-efficacy is really like, at the end of the day, how can I do it? So barriers might be plentiful. It might be that, like, if I get assistance, it won't be as bad, or if the environment allows me to do something, it won't be as bad. But efficacy is unique in that some people may have all the resources available, the barriers might be reduced, but if they don't have that confidence in themselves, no matter what, then that's going to be like a factor that's really challenging in getting them to do that action. So I don't know if that made all the sense, but essentially self-efficacy is different from other types of variables because it doesn't have to rely or depend on anything. It's really just your belief in self, if that makes sense. Alex.
Thank you. No, I think that self-efficacy can be its own thing that we look at. It's just kind of difficult sometimes to parse it from some of these other things.
Yeah, no, totally. And I even in my own theory that I'll talk about in a few weeks, self-efficacy is such a unique variable that we do have to pull out of the coping behavior that people engage in or their perception of the stress. Like it's really its own monster of, do I think that I can do it? But the question that you're posing is a good one, in that if we do reduce barriers, if we have people acknowledge the benefit and things of that sort, it can play into self-efficacy, but it really is its own unique construct.
Thank you.
You're welcome. Okay, so what we're looking at here, and I'm sorry, there are things that are blocking the top. There we go. We're looking at intervention strategies with respect to the construct here. So I won't read them all off, but I will have them in the PowerPoint and we'll come back to them in just a bit as well. But if you were to engage in an intervention, here are the specific ways that some people have utilized some of the constructs to engage in this behavioral action. So if you're thinking about perceived susceptibility as an example, you want to define your population at risk and risk levels. You want to personalize risk based on the person's individual characteristics or behaviors, and you want to make an individual's perceptions more consistent with their actual risk. Again, we're going to be thinking about wearing masks today, and you can imagine how for groups of people for whom the risk is greatest, so typically we're thinking about those with predisposed problems that are existing, or if they're in a population that's 65 or older, you can imagine how the targeting of susceptibility is going to be really important to mask wearing, right? So this box in and of itself is something that you can really dig your hand into to get a sense of, wow, this is, with respect to COVID and mask wearing, this is something that we can understand readily, right? How susceptible one is, how severe it might be. So I'm going to acknowledge this a few times today, but we've crossed a very large milestone. We hit 200,000 passings, unfortunately, today, in which on the one hand, we've got these 200,000 deaths, and then another a CDC report coming out today with respect to 90% of the population still being susceptible. So going between susceptible and severity, we've got two things that are happening today, which are letting us know if we need to target, if we're trying to think about an intervention strategy, there are some elements within these constructs that we might want to focus on. So just being mindful, and again, we won't go through each, but I will have them available for you to read. As you're going through each, there are specific strategies that you might want to use when you're intervening with specific populations. One thing that did pop up in the readings, and also I believe a Kahoot, was thinking about fear arousal in particular as an intervention strategy. So something, which I think about a lot for COVID, I think at the beginning there was quite a bit of fear arousal in that, you know, if you go out the house, if you do anything outdoors, you know, you're so susceptible, it might impact you. Like there was a lot of fear happening. And so here's what we know about fear. Fear messages appear to be most effective when they depict a significant and relevant threat, and when they outline effective responses that appear easy to accomplish. So even though we're talking about mask wearing, and for the most part, in my mind, mask wearing is really easy to accomplish, I think one of the elements that has come up in this class and over time is that there wasn't an effective response from the beginning. The flip-flopping of what to do kept going from foot to foot. When to wear a mask, do you not wear a mask? Like, do you have the N95? Like, it was all this hubbub around what to do. So if we go back to how do we use fear appropriately, it's when we map onto significant and relevant threat, effective response, and easy to accomplish. Those are three elements that are really important in a fear strategy. And if you induce fear while offering no means for removing the threat, or if the action required appears too difficult, it can actually have negative consequences. So people can avoid trying to engage in that strategy if you make it too complex or cumbersome. So those are the things that we're going to be holding in mind as we think about the interventions that have already been presented to us, and as we kind of come up with some of our own messaging around what we want our populations to do. Okay, so HBM, the real world, I'm dating myself there. I don't know if y'all are old enough to even know what the real world is, but if you are, let's think about what HBM looks like in the real world. So we're gonna break off just quickly with a quick partnering activity to discuss the practice-based articles for today. I do wanna acknowledge that our goal, Janae and I's goal, is to really find not only relevant, but understandable materials. So any feedback on whether things make sense as you're reading them, if things are too challenging or too dense, let us know, and we'll try to not only improve the course for this year, but for subsequent years. So definitely give us feedback on the articles. I know these were brief, so I just want to make sure that it's tangible, it's readable, it's something that you're enjoying and getting into. So I want you to discuss the practice-based articles for today. I'm going to put you in pairs of two. So if your breakout number is odd, you're going to discuss the first reading, which was Shepard and Thomas about the pharmacist. And if you have an even group, so if your numbers are, if your breakout numbers are even, you'll discuss the second article by Mukhtar, which was the medical staff. You're just going to be addressing high-level kind of questions with your partner. So I want you to think about the constructs of HBM used in response to COVID-19, so what's going on right now. Within your articles, I want you to think about what's working. So in those constructs that we keep talking about being useful in interventions, in those constructs, what's working and why, and what can be improved on based on what you've learned about the HBM thus far. So again, odd groups, discuss Article 1. Even groups, we're going to discuss Article 2. And we're just thinking about what went well with the strategies that they were applying with the HBM, and then what can be improved upon based on what you've learned about HBM thus far. So any questions before we break out? Okie dokie. So, uh-oh. Okay, something is not working. Give me, hmm. Oh, sorry. Okay, hopefully that works. All right. So we'll come back. It's 1:25 right now or so. We'll come back in about, oh, we'll come back at 1:35. So I'll see you in just a bit.
Tasneem, did you mean to come back to the room?
Yeah, I'm sorry. My like Wi-Fi is really terrible and it like kicked me off and I like don't know how to get back to the breakout room that I was in.
Okay, which one were you?
Number 6.
Okay, let me see if I can get you back there.
I was with Alex.
Okay, it should be there now. You see it?
I was in a room all by myself.
Okay. All right, Lauren. I'm looking to see if there's any other single. Oh, because you were supposed to be with Janae. I see now. Okay. All
Oh,
right,
okay.
Lauren, I'm gonna send you to the room that Taz just jumped into because they should just be starting back up. So I'm gonna send you to 6, okay?
Okay, all right, thanks.
Thank you. Um, we are here. Did it work, Lauren? Oh, okay. Janae, have you tried to use Annotate before?
I know how to use it.
Okay, do the students get a chance to write on the screen, or would it just be me?
It can be everybody at the same time.
Okay. I'm going to see if that works for the next slide, so we'll see what happens. It might be mayhem, but we'll see.
Yeah, it can just be kind of hard because it's like using like a cursor to like do words. So that's the only thing. It's like a little bit illegible, but I mean, for the most part, it works. Oh, you can do text too. I'm saying you can
I
do
was going to say,
text.
okay. If I
Okay, yeah.
click on it now, I hope I don't kick everybody off. We'll see what happens. Okay, yeah, I see text now. Okay, so that hopefully will work. Thank you. What are you enjoying for lunch today?
Asian food.
Mm.
It's basic fried rice and shrimp. But I was so hungry. I don't have any breaks on Wednesday. Like, well, I have like maybe 30-minute breaks, but I don't have any real breaks. So I'm like constantly running around trying to remind myself to eat before I pass out over here.
Mm-hmm. Mm-hmm. Haley and Emma said, "We don't have time for you to pull us back. We are ready to go." Okay, that's what I'm. That's what I'm seeing. Eager, which also means you've solved all the world's problems. So I'm excited to call on you as soon as we get back to the class. Great, great, great.
Emma, I like this decor.
Thank you. I spent like my whole first month here just decorating.
It's very peaceful. It's true. Okay. I have no idea if that's everybody that's back because I can't see the whole screen. So we'll just keep rolling. Okay. Hopefully you're also talking to people and saying like, hello, my name is, and like getting some good just conversation with each other in as well. So I really am curious about what it is that you all discussed. So we're headed to the whiteboard. It's my first time trying this. Janae has assured me that we're gonna be just fine, but let's see what happens. So if you had Article 1 and you discussed a construct and what was being used within that construct right now, I'm going to ask you to go to Annotate Janae, if I were an annotate button for someone who's not the host, where might I be?
Yeah, so it would be the top of your screen where it says you're viewing Rihanna Anderson's screen. You click View Options. There's a drop-down menu. In the drop-down menu underneath Request Remote Control, it says Annotate. So then you click the Annotate button, and it'll show you different options such as text, draw. But for this activity, we're going to use the text feature. And you click the text feature, and you can type away whatever your response is to Dr. Anderson's prompt here.
Okay, Jackson is also trying to take remote control of my screen. I don't know if I need to approve that. Jackson, I'm going to try to decline and we'll see if you can do it without gaining access to my screen, but if not, I'll accept it one more time. So we'll try one more time for those who are reading or who discussed the first article. If you're looking at the constructs to the left, find the annotate text option and stick in some elements that you found particularly beneficial or useful to what they were doing with these constructs. So yeah, go ahead.
Yeah, I just wanted to say for anybody who hasn't ever done it before, if once you click away from your text box, you can't move your text box around anymore. And if two people click in the same spot, then their text will overlay. So just before you click away from your text box, just try, if it's overlaying on top of somebody else, you'll want to move it before clicking away.
Okay, thank you so much for that, Lauren. This is the first time that I've not been a participant and have engaged in Annotate, so I was just trying it out. So we're giving it a go. Jackson, you may have to try again to ask for that permission. Okay, Jackson does not have a drop down. We're giving it our best shot. If it doesn't work in one more minute, we'll just talk out loud. So just give us one more second to try to figure this out.
Okay, so I'm writing in mine. Can everyone see?
No.
No, we can't.
Okay.
Okay.
I think you may only be able to see it if you finish your comment.
Once you're done.
Okay.
Yeah.
And I'm giving people access. I've given 3 people access thus far. So I don't know if, it's a great experiment. Let's see what happens.
It shouldn't be the request remote control. It should be the one right below that, the one that says annotate.
Oh, look, we got something. Yay. Thank you, Erin, for that excitement as well. I agreed. So someone put under perceived barriers, addressing perceived barriers such as childcare and paying bills. Awesome. Oh, we've got blue text talking about the benefits of staying home, like taking up new hobbies. Fantastic.
Wait, sorry, to clarify, is Article 1 the pharmacist article or not the pharmacist article?
Article 1 was the pharmacist article.
Okay.
Okay, and then supplying contact. Oh shoot. It's what Lauren warned us. All right.
Sorry, that was me.
No.
I tried really hard to not have it happen, but it still happened.
It's okay.
I don't know.
Phew, I couldn't move it.
No worries. We're all learning together, so this is great.
I'll type what I have.
Don't worry about it, because now we have even more. Okay, that was a good experiment. We tried. We did really well. So let's see what. I'm sorry. This is great. Okay, so why don't we start with perceived susceptibility? From what I can see, someone has written, underscore the importance of susceptibility for all ages, even younger people, especially because they can still transmit the virus. Thank you for writing that. Are there any other pairs that want to talk about what they saw for perceived susceptibility in that first article? Just out loud and not having to type it.
That was my comment.
Okay.
And I was talking about how it mentioned pharmacists must be careful to avoid implying that there is no threat to younger, healthier individuals. But I think that it's important to also talk about like susceptibility in terms of like their inner circle and their connections, because they can still definitely transmit the virus, so they are still susceptible. And we know obviously that there are susceptibility changes in terms of race and geography as well. So I think underscoring like those different aspects is important as
Thanks
well.
so much, Holly. Thank you. All right, we're just because that took us a little time, or took me time to figure out, we're gonna just jump on maybe two other elements on this screen before we go to the next screen. So for perceived benefits, someone indicated talking about the benefits of staying home, like taking up new hobbies. Are there any other perceived benefits that folks want to acknowledge, or the author of that want to expound upon that at all?
Another one they talked about was like more family time. So if you're not commuting to and from work, you can spend more time with your kids, or just parents or otherwise. Which I hadn't really thought about that as like staying home as a benefit for that reason. So it was interesting.
Yeah, and certainly just a different way of thinking about it, because I think on the one hand, some people might be ready to pull their hair out with the time at home and with their families, but it's really the knowledge that any information that we give to people can be spun in different ways, right? So that's a great point, Kimberly. Thanks for that. Okay, and then let's hop down, and again, all love to everyone who threw some perceived barriers in there. I'm gonna hop down to self-efficacy. I see a red text that just got added in, linking self-efficacy to individual patient health behaviors like drug taking. So does that author wanna explain that just a bit?
Yeah, so my partner and I were talking about, because the article really emphasized the relationship of community pharmacists with their patients in the community, that they may know their patients' health behaviors, and because they're pharmacists, they're if they take their drugs on time or whatever. So being able to link and being like, oh, well, you're really good at doing this. So, and applying that self-efficacy to COVID.
Absolutely. And we'll be, again, talking about self-efficacy and other theories like self-determination theory, but that's such a huge component of so many of the theories that we'll be talking about, is really linking it to, I know that you have the ability to do this, not because I'm an expert or because I believe you can, but because you've demonstrated this before. So it's such a great point that you bring up, Emma, for this study. So thank you all so much for having fun on this screen. We're going to try it one more time, hopefully with the skill set that we've already started for our next, oops. Oh, it stays on the screen. Cool, 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 cool. Okay. That is going to be, wow. All right, let's see what I can do about this.
You just have to hit clear. I think you should be able to erase it.
Let's have fun. Okay, here we go. Clear all drawings. Yay. All right. Woo. Okay. I thought like the whole class was just gonna have to stop and we were gonna throw our computers out the window at that point. That's how I felt. Okay, so now for reading 2, for those of you that were with your partners for reading 2, let's jump in and annotate with text some of the points that they did quite well in that reading, in the second reading. Okay, fast fingers here. Good work. Okay, Taz, while folks are typing, are you wanting to give an answer or you have a quick question?
I wanted to give an answer, but my laptop's not letting me like write it in for whatever reason. I apologize.
Okay. Which construct are you looking at?
I was gonna say perceived susceptibility. Well, perceived severity. It was just like how it was constantly like on the news. Like someone wrote 24/7 news cycle on COVID, but it was constantly on the news rather than information from like experts or like actual health professionals. So just like media outlets rather than like actual health professionals like talking about advice on preventative measures. It was just like constantly like in your face.
Yeah. Okay. Thank you so much for that. All right. So I'm going to grab two people who haven't said anything in this class before. I know that those people exist, but you've just written something on the screen. So can I have one person come off of mute if you've never said anything out loud in this class before? And tell us where you put your text.
Hi, this is Scott. So I put my text in the cues to action. So I think what I would do is try to connect people to government agency or civil society agencies that are providing services and information in the country. I know that during the COVID-19, there were organizations providing sexual and reproductive health for people in lockdown, providing food, water, and so I would try to and free facial masks. So I would try to link people to these organizations for services.
Great, thanks so much, Scott. So yes, absolutely, cueing people to action through other needs or service agencies is a great approach. Thanks so much for that, Scott. One other person who has never said a single word in this class before, and tell us which one you put up here.
So one thing that we talked about was kind of like a potential barrier or problem that we saw in the article that I think kind of falls into self-efficacy, but like every time that someone doesn't wear a mask or doesn't socially distance and doesn't get it, it kind of reinforces in the opposite direction and like makes it even harder to then overcome like the lack of perceived susceptibility and severity.
Yeah, so I think it's a great position. I might put that to susceptibility rather than self-efficacy only, because it is about how susceptible I am to the disease or to this outcome versus how efficacious, how able am I to engage in the behavior of putting on a mask. So that is a bit different, but I hear you, that is absolutely something that we have to fight against. And I've said it before and I'll say it again. I saw people at a club one weekend and I was just like, those people aren't going to get it, you know, the vast majority of them, and it's going to drive me nuts because they're going to show up to the club again the next week. So that's exactly the point of that. Thank you so much, Katarina. I appreciate that. All right, we're going to clear this. Thank you for everyone who put this text up on the screen, and hopefully as we become pros, we can engage in this in ways that are a bit more user-friendly and readable. But this was fantastic to see all of your words up here. So here we go with the clearing. All right, let's keep rolling. Okay, we won't watch this video today, but this is the application and evaluation of a health relief model that the University of Maryland School of Public Health enacted. So it'll be in your slides, and it's about a 10-minute watch, but you'll be able to see how they go through each construct of HBM with the intervention that they've developed, so that you can hear how they do pros and cons as well with respect to each construct, how they engage with specific community members for this specific behavior. So if you want another 10-minute or so application of HBM, feel free to watch this video at your leisure. Not today though. All right, so I want to make sure that we have plenty of time to get into this activity. And again, you all did a fantastic job in submitting your Twitter assignments. Thank you for all the questions. My goal is to try to get as much practice early enough, like a week in advance, so that if you do have questions on the assignment, we can be sure to address it in class on Monday or well before the assignment is due. So I hope that you all understood just like some of the challenges, I think, the last few weeks with respect to the strike and some of the days kind of getting crunched. But the goal from here on out is to have at least 1 week of practice of this activity before going forward. So Looking forward to seeing those tweets, but we're already 1 week away from our next assignment, which is going to be an infographic. Now, all those folks who are talking about IG is your favorite thing on the face of the planet, get ready to use your IG skills, because we're about to develop an infographic, which of course can be used across platforms. So IG, Twitter, Facebook. But we know that IG, based on what we read last week on the why would people use certain platforms, is a pictorial representation. People like pictures, people like visuals. So a place like IG would be an ideal place for an infographic. So I'm gonna share an infographic that is already out there about COVID. And I just want people to talk out loud. And again, I'm really looking for people who I haven't heard the voice of. It's gonna be a pleasure getting a chance to see your face, or at least your picture pop up on your icon. Tell me a bit about what's working with this infographic. And maybe actually let's take a quick pause. What is an infographic to start with? So someone who hasn't spoken yet, what is an infographic? What would you define it as?
Go ahead. I was just gonna say an infographic is just like a visual graphic representation of like information generally.
So if I have never seen an infographic, Sophia, and I am looking at this, do you think your definition fully describes what this is? Is that enough information for me?
Maybe not. I guess.
I'm just asking. So what
yeah.
makes you get a fuller picture?
I guess in regards to this is about coronavirus and your heart. So it's like a graphic and also like written representation of maybe like a health issue or like health information that you want people to know. Like it's like quick, like the most relevant information. So it's easy to see.
Super helpful, Sophia. Thank you so much for that. And there was one other person that was chatting as well. Does that person want to add anything?
Yeah, I mean, I was going to say it's maybe not a document, but a visual and a visual display of information that also has typed words, or text, I guess is the right word.
Fantastic. Thanks so much, Allison. So, and I think Allison's point is really important here, because in 2 weeks' time, we're going to have a one-pager, and we'll describe what that is soon. But a one-pager is often more dense. It has more text. It can have visuals, but an infographic is much more about graphically representing information. So it's going to be much more reliant on the visual, the how to get people to move without having to read dense information. So a great combination of answers from Sophia and Allison. So if I haven't heard from you, again, I'm gonna just rely on this group one more time, very quickly. Tell me what's working about this infographic. Give me just one quick thing from folks who haven't chatted yet about what's working about this infographic.
I would say like how colorful it is and how like appealing it is to the eye, like it's got pictures, like I said, it's colorful, the text is bold, it's getting you what you need to know, and there's bullet points. So I would just say that it's attractive to the viewer.
Thanks, Janae. And to actually go toward the point that a lot of you have made in Kahoot, the color scheme is important, right? So the red coronavirus module up top is like coming over to these blue things, and we have been trained psychologically to see red as something that might be a threat or bad, and blue in some instances as something that's more palatable. So just taking a look even at something like that, where the red represents threat on here, there's the virus, and then the things that are in blue, the healthcare workers, the individual, it's interesting that they're using those color schemes. So just putting that out there to Janae's point. One other thing that's working well for this infographic from someone who hasn't chatted yet.
I was gonna say that it is both, like you could read it from top to bottom and like follow it. It's very clear like why the delay and then what you can do. Like it's intuitive, the steps it takes, but it also, if you're not gonna go through all of it, the headers and the different things make it easy to like quickly snapshot what's going on. Like I know it's postponed heart procedures. If I know why there's a delay, I can skip to what I can do. Not that it's like too much to read all the way through, but I think like if you are passing it or something, you could navigate very quickly without starting from the top and going through.
Great point, Alex. Thank you so much. All right, briefly for folks who haven't chatted, are there any things that you would want to improve about this? Maybe one thing that you would want to improve if I haven't heard from you yet.
I would say like adding or like replacing the images with something that adds more, that is kind of relevant. I think the images, while they're nice to look at, they're not adding in any more information, and it's making the text even smaller. Like I'm not, I don't have like, I don't need glasses anymore, but I can't really read the text very well because it's so small.
Great point. Thank you so much, Tiffany. One other point from someone I haven't heard from.
I think to me.
Oh, go ahead.
Okay, I was just gonna say. I think it's almost for me like a little bit busy. I know some people's philosophy on infographics is that they should be like pretty simple, like get your point across. And to me, this almost seems like a little bit more like a graphic fact sheet in a way. Like the way that I've been introduced to infographics, it's like almost bare bones, like get a few things across, but there's a lot happening here, and it's just kind of like, where do I look at? Like it's all at once. It's like I don't really know where I should be looking. So maybe making it a little bit less busy, making some of the text a little bit bigger, etc.
Thanks, Kate. Natalie?
Oh yeah, I was just gonna say, at first when I like looked at it, I thought with like the title at the top, coronavirus in your heart, I thought that this was gonna talk about like heart-related issues with COVID. And I didn't really put two and two together until like I started reading that they're talking about like people with already pre-existing heart conditions. So I think just the title at the top, maybe like different rearrangement of that to kind of like, okay, this is what this is talking about. Yeah.
Okay, thanks so much, Natalie. Okay, well, let you all, I'm gonna stop share for a second. I'm gonna share that running Google Doc. So I'm gonna just continue to put in-class activities on this Google Doc. So at the top of this Google Doc, it's gonna let us know what it is that we're up to for today, which is to develop just one infographic on one element or one construct of the health belief model with your group. So the things that you've already indicated are sizing and readability. How does an average consumer scroll or view content? So up and down, left or right, those are things that you've already talked about. Color palette, and then something that you'll be thinking about when you actually have the assignment for yourself is the number of infographics in a series. If you were to think about, if you're on IG, will people go from one to the next, or will they continue to scroll past if you have too many infographics in your series, or too many pictures within your series? So I'm gonna add a few more things if you wanna shout it out, but from what I heard is just, I guess beyond sizing and readability, just, the busyness is something that I heard. What are other things that you all, oops, that's business, that's not it. That's not it. How does one spell busyness? Too busy is just what I'm gonna put. Great, golly, sorry. Yeah. Okay, what other things were what you all were saying are should be kept in mind as you're creating this or as you're trying to develop one yourself?
I would say that it's short and to the point, so not too much information, but make sure what you have is important.
That's a great point. Thanks, Jadrian. What else?
Kind of to go off of that, it should be easy to follow. It shouldn't feel like you have to jump around from image or like context bubble to bubble.
Okay.
I was gonna say to enhance visuals, like using symbols and shapes and like arrows to kind of make your point.
Great point on that. Thank you. One other thing.
Also, I think also like in line with short and to the point, I always find it helpful like at the bottom if there's like a read more about it here or like a link in case I'm like, oh, I am more curious or I want to, just have even more information.
Great. And you'll see that, great point on that, Kimberly. You'll see on some of the examples that are provided exactly that point, one of my best friends in the research world always has her RAs create the QR code. And so you can use your phone to go to that longer text or whatever it is that you would want people to read should they choose to do that. But what I'm hearing you all say is that in and of itself, someone should be able to look at it, take information away, and go with what they know. So we're going to break up into groups to try to create, again, just some bare bones content of an infographic, just so you can talk through and start to process what it might look like with one HBM concept, to think about how you can increase your population's mask wearing. So folks your age, it could be folks who are in grad school. I talked with someone for office hours who was talking about people going to like the football game, for example. So like think about what your population is and how you want to target them using one construct of HBM. And if you do need help, there's that how to create a compelling infographic that's up there. I know last time we also talked about Canva. So if people are not familiar with Canva, I'll just make a plug for Canva for your own personal use. And thank you, Caitlin. I'm seeing your comment there as well. So any questions before we break out and you just give it a try on what you might want to create one infographic about with your group? Any questions before we break out? You all are pros at this point. So I'm gonna just give you all about 15 minutes or so to break out with your group to try to get one infographic bare bones on paper. It looks like Sophia might be frozen, maybe. Mohammed, are you there? Well, when Mohammed comes back, he will be in a group with Janae and I, so fantastic.
I actually know Muhammad. Oh, okay. Well, that's fine. I was gonna say I almost unmuted myself to call him out earlier for the infographic thing because he actually he worked with me on a couple of projects and like taught me how to do infographics successfully and stuff like that. So I was like, of course you don't want to speak up for this part, Muhammad, and you know all the information.
Well, now that I know that, you know, I'm going to call him out at when we come back. And then Tiffany, who made a comment, her name is Kathleen Tiffany Lee. She does our infographics for Embrace. I was not going to put her on the spot, but she does a very good infographic. So we've got some scholars, some stars out here. I'm also realizing that things are recorded right now, Janae. So just being mindful that of that. always like a game of chicken. I just wait to see who has to get cut off or who joins willingly. It's just so interesting, truly.
The countdown gets stressful when like
I
someone's
know.
in the middle of a topic and it's
I
in
know.
your face.
I know. I too am in breakout rooms sometimes, so I understand. Okay, so we only have a few minutes left, but I wanted to check in on the process of the infographic. Was that helpful to get a chance to work with a group? I'm seeing some head shakes. Are there any things that you're not clear about in constructing your infographic a week before the assignment? So again, the assignment is going to be more detailed on the syllabus itself. You're going to have to look at each of the constructs of HBM to create an infographic about each of those. But are there things that you don't know about how to create an infographic, or what would be important that we can discuss briefly here?
I don't know if it's in the syllabus. Honestly, I haven't checked yet, but are we working on this individually or can we do it in groups?
So it's a great question, Maureen. So each of the assignments up to the final is going to be an individual process. And then in the final assignment, you'll be able to work with a group to suss out or to come together to do a compilation of infographics, videos, whatever it is that you want to do. But for these, the building blocks of them, you're just going to do them individually.
Okay, and then in the syllabus, I mentioned the TPB theory and not HBM. So
sorry about that. Yep, so that's fair. Sorry, yes, there's too many kind of at once. Yes, so next week it is going to be about the theories that we do next week, which is TPB and TRA. So thank you, Simone, really appreciate that. Mega?
Yeah, I just had a question in terms of using pre-created like stuff on Canva. Should we be creating like everything from scratch, or can we use like their images and things like that?
Yeah, so unlike the Twitter chat where you could pull like an entire piece of someone else's stuff and just kind of highlight it on your thread, this is going to be trying to create as much as possible. If it's a person who's already been created, like I don't know how to create a person, please go ahead and grab that person, but you're not going to grab someone's whole infographic and say, this is a great example of one. So I do want you to try to develop the text as much as possible, but if Canva has a really good template, by all means, utilize that. Oh, go ahead.
Yeah, I just wanted to make sure, verify. So we're making the infographic specifically Detroit centered, right?
So I do have to apologize about that. Janae got me on it last time as well. I talk about Detroit all the time. That's my baby, that's my population. That's who I'm thinking about when I'm creating my stuff. Your final project is going to be on Detroiter. So I am going to specify your population for the final project. For this project, go ahead and tell me who your population is. It can be whoever you want to focus on. That is my error for not clarifying that last week before the Twitter assignment. There's going to be no, like, it does not matter to me if you chose Detroit or not. That's okay. But for the final assignment, it is going to be Detroit based.
Okay, thank you.
Thank you, Lauren. I know we're at time, so any other questions that would be helpful for the whole group on infographics?
Also, are we making one infographic with all the constructs in it, or are we making 6 infographics, each specifying on a construct? Sorry.
Yeah, yep. So for next week, that again, it's my bad. It's not HBM. It's going to be TRA or TPB, the theory for next week. You can choose to have several different infographics with each of the constructs on each of the infographics. So you can make a different infographic like for each of those constructs, or you can have one that incorporates different constructs, but you just have to make multiple infographics like that. So it's up to you, but you have to demonstrate at least your knowledge of all the constructs at some point in the infographics, okay? Okay, if you have other if you have questions about the infographic, now we have a week, so feel free to let us know and we can bring it back to the class on Monday. For those of you that are signing off, by all means, have a fantastic day. For those of you that can hang around just to answer one thing that you learned today and one way that you're gonna apply that to your life, I'd love to hear it.
After the lecture that we had today, I actually was able to self-critique my work on the Twitter assignment, which I felt was really helpful. I think I still did a really good job, but the lecture we had today and putting some things into perspective, giving some examples really helped me think like, okay, if I was going to do this again, this is what I would do differently. And this is what might be a little bit more effective. So I'm going to take that into, what'd you say?
I was going to say, Carly, guess what? You get to do it all over again for your final, isn't it? So you can
Yeah.
exactly what's going to happen. Thank you, Carly. Taz has put something in the chat. One other thing that has been something you learned today or that you're going to apply to your life?
I really appreciated the readings that we had for today because I felt like they were really nice that we got to see how these theories we're learning about were actually applied in like something that's happening really relevant to us right now.
Yeah. Thank you so much, Megan. That is our goal. So we're going to be looking as much as possible to do that. And even, for example, next week, none of them are specifically related to COVID, but during, like, if we can find one by the time class hits, we can even make it an in-class activity. So we're going to keep looking for videos, readings, etc., that can be helpful. But if you all come across stuff, feel free to send it our way too. We got some really great tweets that people sent about COVID and really appreciate that as well. All right, I'm going to be looking at the chat. You all have a great day. Stick around if you want to chat anything out, but thanks so much and enjoy the weekend.
I had a question, Dr. Anderson.
Yeah.
This is about self-efficacy within the health behavior model. And I wondered if self-efficacy is actually detrimental to health behavior. Because think of it from a COVID perspective. I feel I'm resilient, and I feel because of my resiliency, I am self-efficacious enough to not see COVID as a threat, because of which I feel COVID is not a threat, because of which I'm not engaging in the precautions like wearing a mask or maintaining social distance. So isn't self-efficacy actually detrimental to the entire model?
Yeah, it's a great question. And one, I see just how much we'll need to focus on self-efficacy in and of itself. What you described is less about efficacy. And why don't I start with efficacy and what it would be in this case? Efficacy really is, do I have the ability to put on a mask? Like that's in this case, when we're talking about the behavior of mask wearing, efficacy is just about ability to do that behavior. So can I physically put on a mask is the question about self-efficacy. In this case, I'm going to argue that most people would say yes, that they're able to. For some people, clearly that's going to be more challenging. But for most people, I would argue that the self-efficacy of putting on a mask is high. What you were talking about is more about susceptibility. Will I be susceptible to COVID, right, to the virus? That is where people are like, nah, like I have very low susceptibility to this. Their belief around perceived susceptibility, whether it's true or not, is very low.
But wouldn't my self-efficacy or my ability to do something be dependent on what I understand are my strengths? So wouldn't, in that context, that's how I connected my question to it. I feel I am resilient. So therefore, I feel I have the ability to fight this virus without taking care of any precautions. So wouldn't that be seen under self-efficacy, or would that still be perceived susceptibility?
So I would argue that efficacy is still going to be just about the behavior itself. So can I put on the mask is the behavior. Whether I believe I'm going to catch the virus or I'm resilient to it or any of those questions, those are more about perception of that susceptibility, perception of how severe it will be even if I did catch it. So that's why, I don't know if you remember, but one of the first slides that we talked about was how you can have multiple things being high. So even if I think that I can do it, so if my efficacy is high and I perceive the severity of it, so if I were to catch it, like I might be on the couch and not able to move. So that might be high as well. But if that third thing, how susceptible, so maybe all of those things would suck and maybe I know how to put on the mask, but if I don't think that I'm going to catch it because I've been outside before and I've been around other people and I don't know anybody in my friend group that's gotten it, then that can be the one thing that throws everything else out the water, if that makes sense.
Yes, so susceptibility is more cognitive and efficacy would be more behavior related.
those perceived, all the things that Janae was like emphasizing, the perception of those things are very cognitively based. So they are based on data and what's happening, but it's that perception is a cognitive monster. Like, it's what do I think? And then self-efficacy is also about what I think, but it's related to the behavior. So what do I think I can do? What am I able to do about that behavior?
Okay, yeah.
Okay, thank you.
All right, thank you.
Thank you. All right, other folks, sorry about that. What else we got?
I had a question, but if you need to go, I can do it in
No,
office
I'm
hours or later.
fine. I just want to, yeah, anybody that needs to go.
It was following up, not following up, a different side of the coin of the perceived susceptibility.
Yeah.
So something, and I obviously the issue here isn't people like being too, like thinking that COVID is like too catchable, but I've noticed like a lot of people that, you know, believe in COVID and masks and everything in my circle have this idea of like, one exposure, like if you've exposed, you're exposed, and like that's it, you have it. So like my mom, for example, works in person, and so they have different offices and masks and distancing at work, but then she seems like she'll like go do something with her coworker outside of that because she thinks like, oh, this person is already in my circle, like, so it's like the idea, and my partner was with his mom and they had an exposure event moving a brother into college. So they both came home, they were isolating, and then they're like, oh, only one of us needs to get tested because if one of us has it or doesn't have it, if one of us has it, then the other one does.
Right.
Like the idea that it is like so catchable that it's a yes or no. And I don't know if that's the other side of perceived susceptibility. And I don't know if that's harm reduction strategies.
Yeah, it's a great point. So I don't know if there was a questioner that was just kind of trying to think through, but it's a great point, and it reminds me of knowledge around HIV. And so like the idea even that two people who have positive HIV statuses sometimes don't use contraception because they think once I'm exposed, that's it. But that there can be differential and exponential harm if strands are mixed or if they're exposed to other types of strands like that. That's something as you're saying that comes to my mind, which is a lack of knowledge about what is possible. So I don't, Janae, feel free to correct me if I'm wrong on this one. That to me does not ding as much as susceptibility as it would like psychoeducation or a lack of just knowing some of the details around that. What do you think?
Okay.
If that's about right.
I agree. Yeah, definitely.
Yeah, I've just seen lots of like my mom goes on a walk with her coworker every day at lunch, and the other day she was like going to give this coworker a ride somewhere, and I was like, well, that's kind of different. And she's happy to be like, if someone tells her, oh, that's risky, she'll pull back, but that makes sense. So it's not quite susceptibility, it's more misunderstanding.
It's not far off of susceptibility, because what you just said in that example actually clarified a little more that it could be like, if I'm not susceptible to this person, then whatever environment we're in, like I can be okay with them, whether that's an enclosed space or an outdoor walk. So that is about susceptibility, but it is it's psychoeducationally, like the reason that we're talking about social distance is because once you create a room or a barrier and molecules and particulates can like bounce off of those things, that's going to make you more susceptible. So it's not far from that, but it's not purely susceptibility, which is more along the lines of I'm invincible to this, or like I would never catch it because I eat healthy and blah, like that to me is more pure susceptibility, versus if we can educate people better on what makes them more susceptible, then they'll be like, that'll be more aligned with their knowledge around that construct. Yeah.
Thank you. Yeah, it's interesting to think through I think the clarity, a lot of the theories and models that get complicated, there's clarity with like talking through it. So even in me and Vishaka were in the same group, and like we started broader with infographics and like, thank you. Thank you.
And I think to Janae's, smartness on all of this, like having your groups that we've kind of created or using the discussion boards allows you to talk this out more. So feel free to keep talking it out. That's what we want you to do for sure.
Thank you.
Thanks,
Yep.
Alex.
Thank you so much. Bye-bye.
See you. Have a great weekend. All right, Janae, have a fantastic rest of your day, and I'll see you tomorrow.
Okay, sounds good.
Okay, bye-bye.
Okay, bye.